friends. Welcome. I welcome you all, and immediately we will start our lecture, which is regarding the Mansa Dhatu. Today, we are going to discuss a very important dhatu in our body. But as you know, my dear friends, we are learning Ayurveda. So, Ayurveda has its own specific terminology. Because when I say dhatu, those who don't know the Ayurveda, they may be allopathic, homeopathic, naturopathic doctors or laymen. They will say Dr. Deshpande is going to talk today about metals, gold, copper, and silver. No, that is not the thing. Because dhatu in Marathi language, if you say this dhatu word, in Marathi language, the English translation is metal, M-E-T-L. But when I talked about Ayurveda and when I pronounce a word dhatu, it has a specific terminology. Dharanat dhatvaha. This is the nirukti of any dhatu. Dharanat dhatvaha. So which maintain our body from birth to death. They are important 7 dhatu or the elements of our body. For the comparison from the modern physiology, you can compare with the tissues. Like for example, Mansa Dhatu can be compared, I am not saying equal to at all the time, can be compared to the muscle tissue of the modern medicine. And in our general medical practice, there are a lot of patients come to you complaining of problems of Mansa Dhatu or muscle tissue. Simple thing is muscular pain. I am having the back pain, backache. So backache is many times muscular pain. So you can easily diagnose. Suppose one person complains to you, I have the calf pain. Calf is a muscle on the leg, back side of the muscle, calf pain. So always heaviness of the legs. Then sometimes when you do unusual movement, like lifting something or catching the train, and you get the cramp, that is also the muscle cramp. So when we talk about musculoskeletal system, the important element is muscle tissue or Mansa Dhatu. Today, we are trying to understand the Ayurvedic approach, Ayurvedic concept regarding muscle tissue or Mansa Dhatu, presented by, of course, here you can see my name, Professor Dr. Rajendra Raghuvir Deshpande. I am the professor and head of the department of CRC Kriya Sharir department in CRC College, College of Ayurveda and Research Center, Nigadi Pradhikaran, Pune 44. I have written near about 60 plus books. One of these books you are seeing on the screen, Kriya Sharir, paper 1 and paper 2 textbooks. Okay, let us move further. And I will try to scroll my screen further. Okay, here I am. I will try to go next slide, one after another. There may be some technical difficulty today. Okay, so this is the part of Mansa Dhatu from Kriya Sharir or Sharir Kriya. The CCIM says Kriya Sharir. Paper 2, part A is always Ayurvedic, and point number 4. This is from the syllabus, and this is my degrees, post-graduation, MD in Ayurvedic medicine and Ayurvedic physiology. This is my website, ayurvedicfriend.com. This is my mobile number, 9226810630, and this is my mail ID, professordeshpande@gmail.com. You can contact me for online consultation, palmistry, online classes, this and that. Next, these are the textbooks you can see. Kriya Sharir paper 1, paper 2. These are written in Marathi and English language for Maharashtrian students. But these translations are available in Hindi language, also There are books on the Chaukhamba publication. You can search on Google, and these books are available in English language as well. So Hindi, English, Marathi, Dr. Deshpande has written in all languages. Okay. So this is a handbook, very interesting book. Kriya Sharir handbook for fast revision. So this is Hindi and English. This book is in Hindi and English. It covers fast division of paper 1, paper 2. Can you see my cursor? Practicals, instruments, histology, important shlok, all basics of Dosha, Dhatu and Mala. Okay. Next. This is practical book, Kriya Sharir practical book, as per the very new syllabus formed by the CCIM in 2012. Ayurvedic practicals like Prakriti Parikshan, Sara Parikshan, Agni Parikshan, modern hematological practicals, CNS and CVS examination. This is very important book, very popular book, clinical examination, English language, okay? Systemic examination of 8 systems, digestive, respiratory, cardiovascular, excretory, nervous system, endocrine system, how to examine the system. This is described in clinical examination book. Ayurvedic Srotasa Parikshan, clinical significance of lab test, radiology, USG, 2D echo. Next, we will try to go on the next slide. These are the English books available. Okay, let us move further. Okay. Sometimes today I am facing a little bit technical difficulties, but okay, I will not go with this. Okay. My dear friends, please excuse me. I will speak in English, but the matter is unfortunately taken from my Marathi book. So, what is the importance of Mamsa Dhatu? It is said, I will first read whatever there in Marathi language. Rajyakshma Madhumeha सारख्या आजारात उपचार विना बराच काळ लोटला तर मांसक्षयामुळे अस्थिपंजर देह कसा विकृत होतो हे प्रत्यक्षात पाहता येते. I have said that in the any degenerative chronic diseases, for example, I will mention you cancer, tuberculosis, and uncontrolled diabetes mellitus. In these diseases, the day by day person loses his weight. There is a problem of weight loss, and weight loss is connected with Mamsa Dhatu. Of course, weight is related with Mamsa Dhatu, Med Dhatu, and Asthi Dhatu. Muscle, fat, and bone all comprises our human body weight. But Mamsa Dhatu, it is called as a muscle wasting. Mamsa Dhatu Kshaya. You can see the cheeks are going in, there is no muscles over here, bicep and tricep, they are wasted. So this muscle always give the person very beautiful appearance, a shape to the body. Always, otherwise the person will look very shrink. That means loss of weight and lean and thin. He will not look good. So in Bollywood also, there is a craze of muscle packs, abdominal muscle packs. So Mamsa Dhatu is giving shape, but most important function is making you strong. You are physically strong because of only two dhatus. One is Mamsa Dhatu and second is Asthi Dhatu. So proteins are important for your body, and vitamin D and calcium is important for Asthi Dhatu. Before going further, let me talk something about Dhatu. Ayurveda says our human body is composed of Dosha, Dhatu, Mala, Mulami, Shriram. Bioenergies, Vata, Pitta, Kapha. Vata is for movement, Pitta is for metabolism, and Kapha is for nutrition, stability, and growth. These bioenergies are working through the medium of body tissues. They are 7 tissues: Rasa, Rakta, Mans, Med, Asthi, Majja, Shukra. So our body is composed of Dosha, Dhatu, and Mala. 3 Mala are there: Mutra, Purisha, Sweda, urine, stool, and sweat, waste products. These dhatus are important for healthy person to maintain our health, because Sushruta has given the definition of Swastha Purusha. Who is a healthy person? Samadoshaha Samagnischa. Samadhatu malakriyah prasanna atma indriya manaha swastha iti abhidiyate. You must remember, because we are talking about Mansa Dhatu. Any question on Mansa Dhatu, start with this introduction. Because there will be question, LAQ, long answer question for 15 marks. Describe, nirukti, properties, function, site, and Vruddhi Kshaya Lakshan of Mansa Dhatu. So, while starting this LAQ, you can give this is little bit introduction of any dhatu. So, I am talking about general concept of dhatu, dharana dhatavaha, to hold the body, to maintain the body from birth to death is a function of all the dhatus. So, I have talked the importance of in swastha vyakti, samadoshaha, samagnisha, samadhatu. What is meant by samadhatu? Sama in parallel, modern medicine, homeostasis, balanced condition, quantitatively, qualitatively, functionally, these dhatu should be in physiological limit. As you know, LIC has created height weight chart. So everybody can check on the weighing machine whether my weight is according to my height and according to my age. But basically it is related with the height. Height weight chart is very important. That gives you the idea about the nutrition of the person. Mansa dhatu nutrition is very, very important. Upachit, Ayurvedic word, nutrition. And opposite word is apachita. Upachit, apachit. Well nourished, malnourished. When I say malnourished, there is two factors in Ayurveda, Vruddhi and Kshaya. This is abnormal, pathological, unnecessary excessive hypertrophy of the muscle, excessive growth, and low Mansa Dhatu Vruddhi, hyper, Mansa Dhatu Kshaya, hypo. This is very important concepts of Ayurveda. Remember, Vruddhi and Kshaya, malnutrition, overgrowth, undergrowth. And very well, you know, when there is a undernutrition in rural or slum areas or Adivasi areas of India, because India is a developing country, very, very poor people, no food to eat. Lot of Adivasi areas are there where these people, tribe people, and they can't get the enough food for eating, and they suffer from protein, calorie, malnutrition. Are you writing? Write down, write down. Protein, calorie, malnutrition, PCM. What is the disease? PCM. This is connected with Mansa Dhatu. Marasmus. Marasmus. Teen child, 5 years old, 6 years old. And another typical protein deficiency. Only protein, calorie, protein, carbohydrate, marasmus. Don't forget it. Only protein. What is the disease? Kwashiorkor. Very difficult spelling. Kwashiorkor. Kwashi. Kwashiorkor. Only protein deficiency. The person, the child has a edema. Remember, edema on the hands and legs. Belly, like abdomen. So this is two diseases of undernourishment. Marasmus, kwashiorkor, related with Mansa Dhatu of Ayurvedic concept. I have talked about samadosha, samagnisha. Samadhatu is not there. Then I will tell you about importance of dhatu in diseases, pathological. Doshas are god and demon. Doshas, D-O-S-H-A, Vata, Pitta, Kapha, god and demon. When they are physiological, like a god. When they are in pathological, like a demon. Then these doshas attack on the dhatu or mala. Whoever are weak, W-E-A-K. Whichever the tissue is weak, Vata, Pitta, Kapha will attack. What is the samprapti? What is the pathogenesis according to Ayurveda for any disease? Tell me, what is samprapti? Dosha, Dusha, Sammurchana, Janito Vyadihi. Combination, that is pathological, amalgamation, union, pathological of dosha and dhatu is called as a sammurchana in Ayurveda. Ayurvedic words, sammurchana. Janito, created, vyadhi means disease. Now, last sentence about introduction. You will be asked in the Vaiva, tell the Sreshta karma of each dhatu by Vagpat Ashtanga Rudaya. Sreshta karma of each dhatu. Prinanam Jivanam Lepaha. Sneho Dharana Purani. Garbhotpadashta dhatu nam Sreshtam karma kramat smrutam. Prinanam Jivanam Lepa Sneho Dharana Purani. So Prinan Rasdhatu, Jivana Raktadhatu, Lepana covering Mamsa Dhatu, shape of the body. But important function is muscular contraction. Muscle contraction process is very important. That gives the activity. Whatever we do, standing, sitting, running, jogging, everything with the help of Mamsa Dhatu attached to the bones. Activities depend on Mamsa Dhatu. Never forget it. Okay, let us move further. I think I have to go every time with this. Okay. Nama Nirukti and Paryaya. The name, how the Nirukti means etymology, how the word has, and Paryaya, what are the different synonyms. So Mamsa Dhatu is always under the skin, and this is the medium for different movements. I am not reading the Marathi now, directly translating in English. So there are different synonyms in Amarakosha. Pishita, Tarasa, Mamsa, Palala, Kritya, and Abhisham. Pishita, Tarasa, Mamsa. I will not go much into detail because they are not practically very important for our practice. Pishita, some explanation is given, which any element in our body having the length, breadth, and thickness is called as a Pishita in Sanskrit. Pishyate iti. Sanskrit, Pishyate iti. So it is divided into different compartments, and so this is a part, like a part, segments, okay? Muscle mass. Tarasa. Taraha asti asmin iti acha. The element which is responsible for strength is called as a tarasa. Then palala. Palagatau ka palati palyate va anena. Very interesting, but not very important to remember. Don't get stress of this in Sanskrit. Only understand the meaning. So, which has a length, breadth, thickness, which has a element for strength, and this is a element for movement. Palala, element for movement. Next, kravya, by which we get afraid. Even the muscular person comes in front of us, we get afraid. Then this particular element has a nutrition from blood. So it is also called as Rakta Tej, Rakta Bhava, and this is responsible for nutrition of Med Dhatu. So Meda Sakrita, we are talking about Paryainav, synonyms of. Then there is a word Amisha, okay, because it is, we can eat the most non-veg, it is a non-veg eating purpose, and there is also name of the Kashyapa for this Mamsa Dhatu, because he has some invention, he has some research on this Mamsa Dhatu. So name of the Rishi or the name of the Sadhu, Kashyapa. Next, coming to the 15th slide, Sthana, where it is, site of the Mamsa Dhatu, all over the body, below the skin and above the bones and all over the body, because bones and the joints they are covered with the muscles, okay? Then if you exceptionally, you forget about teeth, you forget about the nails, but all other extremities, they are the skeletal muscle. Hands and legs, skeletal muscle. Hands and legs, skeletal muscle, Mamsa Dhatu. In abdomen, stomach, intestine, large intestine has a coating. You know the histology of stomach, histology of the small intestine, four layers. Do you remember? Mucosa, yes. Submucosa, muscular, and serosa. Correct. These are the four layers of on visceral organ. Viscera means ashaya according to Ayurveda. So stomach and intestines are also having the visceral muscles and cardiac muscles. Three types of Mansa Dhatu: skeletal muscle, visceral muscle, and cardiac muscle. So you must read all these modern part as well. Next slide. So you can see the muscles. Very interesting pictures. Major is pectoralis, this muscle, very good muscle. Okay, bicep muscle, can you see? Then here, quadriceps muscles, calf muscle that I have already mentioned. These are the facial muscles. Okay, next slide. We will go for the next slide. Muscles of the chest, muscle of the abdomen. You can see the pictures afterwards. Muscle of the forearm, muscle of the hand, muscles of the leg, muscles of the foot, everything is there. So you have to make a snapshot, or while you look the video, you can take the pause. Take the pause, see the muscles, go ahead. Take the pause, see the muscles, go ahead. This way you can do this for this video. But we want to get understanding. Sthana, there is a Mamsa Dhara Kala. Write down this word. Mamsa Dhara Kala. Tasam Prathama Mamsa Dhara Nama Kala Karsar. Yasya Mase Siras Nyayu Damani Srutasam Pratana Bhavanti. Yatha Visamrunalani Vivardhante Samantataha. Bhumo Pankodaka Sthani Tata Mamse Siradeha Sushrush Sharir. There are 7 kalas mentioned in Ayurveda. These are the layers, coatings, and in Mausudhara Kala, there are the vessels, ligaments, arteries, and important is Mamsa Vaha Srotasa. Mamsa Vaha Srotasa. What is Srotas according to Ayurveda? Micro and macro channels. And what is the function? 4 important function of any Srotas. 4 important function of any Srotas. Remembering? No? Write down. Utpatti. Utpatti. Creation, formation of that dhatu. Parinamana. Metabolic processes. Parinamana. Vahana. Transport of nutritious material. Transport for next dhatu. Nutrition. Raw material. Vahana. And utsarjana. Each dhatu has a waste product. You know that. Protein metabolism. Amino acids are disintegrated. Ammonia is formed. Urea is formed. And through the liver and through the stools, it is excreted to the urine. Urea is excreted in the urine. I am talking about Mamsa Dhatu, protein metabolism. Next dhatu, or rather next slide, sthana. So, Mamsa Vasrutas I already explained, Utpatti, Parinamana, Vahana, Utsarjana. Then, Dhatunse Akunchana Prasarana. Contraction relaxation is always with the muscle. Tvacha, skin, is a Mula Sthana of Mamsa Vasrutas because it is related with the Lepana function. Remember, Lepana function. Mamsavanam Srutasam, Snayur Moolam Tvakcha. Snayur Moolam Tvakcha. Muscles and skin. These are important factors in this particular Srotas. Charak Vimanasthan, chapter 5. Description of Srotas. Next slide. Swarup and Sangatana. Structure and composition. How that Mamsa Dhatu is formed. Sarvam idam panchabhotikam asmin arthe. Ayurveda says each and every element on this earth is made up of, is formed from Panch Mahabhut, 5 basic elements. Prithvi, Aap, Tej, Vayu, and Akash. Prithvi, Aap, Tej, Vayu, Akash. Prithvi, earth. Aap, water. Tej, fire. Prithvi, Aap, Tej, Vayu, air. Akash, ether element. Ether, space element. Okay. But Vyapadeshastu Bhuyasa. This is the law of Ayurveda. Write down. Vyapa deshastu bhuyasa, comparatively predominant. Mausam parthivam. Sushrut sutrasthan Chakradatta Bhanumati Tika. It is very well specified that Mansa Dhatu is parthiva. So you must eat parthiva substances. High protein and high calorie diet will require for Mansa Dhatu, because Mansa Dhatu is a Prithvi, earth predominant. Okay, next slide. Let us go further. Just a moment. I will try to get the screen, because sometimes it is difficult, technical difficulty. Okay, next slide. Prakar. Each dhatu has two types, sthai and asthai, unstable and stable. What is that? Raw material and final product. Raw material and final product. And what is peshi? Mamsa avayava sangataha, sarcomeres. Muscle tissue, sarcomeres. That particular Mamsa avayava sangata paraspara vibhaktaha pesh iti uchyate. Structure of muscle. Can you see this? Next. Types of muscle: skeletal muscle, smooth muscle, and cardiac muscle. Parinamana, metabolic process according to Ayurveda. Raktam Mamsa pushtim karoti. If you have the anemic person, your Mamsa dhatu cannot be built well. There will be cramp, muscle cramp always, muscle pain always, if you have the anemia. Because blood provides the protein material. Amino acids are provided by blood. So, Raktam Mamsa pushtim karoti. Blood carries the proteins, blood carries the amino acid, blood carries the albumin, which is required for the formation of muscle dhatu. Raktat agnipakvat malaha pittam sthula bhaga shonitam anubhagastu mausam iti. Tato api atma pavaka pachamanat malaha shrotra nasa karna akshi prajananadi stroto malaha sthulo bhagaha mausam. Sushrut Sutrasthan has given this description. Trividha Parinamana. Trividha Parinamana. What is Trividha Parinaman? Final product, then precursor for raw material for the next dhatu, and waste product. Okay, let us see further. Okay. Parinamana. Can you see over here on the screen? Agni Sanskar is very important. Mamsa Dhatva Gni, please write down. In Mamsa Srotas, Mamsa Dhatva Gni is acting, and it is converted to the Parthivatva of or Mamsa Dhatu formation. And then Parthivagni will act and give the structure of Parthivatva, because Parthivatva, earth element in the Mamsa Dhatu is different, earth element in Medha Dhatu is also different. So in Mamsa Srotas, there are two functions, Dhatvagni and Parthivagni, Mamsagni and Parthivagni. Here you can see Rakta Dhatu is basically blood, is liquid and Pravahi, but after the Sanskar process of Vayu, Agni and Tej, Vayu, Agni and Tej, then Rakta is converted to Mamsa Dhatu, which is solid, is not liquid like blood. It is stable and it is Sandra, having some mass, MASS. So totally from Rakta Dhatu, total another Dhatu is formed because of the process of Vayu, Agni and Tej, according to Ayurveda. Don't forget this. Here, Agni is Mamsa Dhatu Agni. Vayu Ambu Tejasam Raktam Ushmana Cha Visanyutam Sthiratam Prapyam Mamsam Syat Swa Ushmana Pakvam. So the blood is red colored, but after it is, Mamsa is ficat. That means very faint blood, red color, faint red, is not dark red as like the blood. Next slide. Tridha Parinam. This word is very important for metabolic process of any dhatu. Tridha Parinamana. Parinamana is a transformation. Parinamana is a conversion. Parinamana is a digestion. Parinamana is a metabolism. So here the raw material has come in the Mamsa Srotas, Mamsa Dhatu Poshakansha. Mamsa Dhatu is there. Then Poshya Mamsa Dhatu and Upadhatu, secondary tissues, are Vasa, Omentum, and Shat Tvacha, 6 layers of the skin. These are the Upadhatu of Mamsa Dhatu. Then Poshakaunsh of Medha Dhatu, Sthula Mala, that is Kha Mala, and Sukshma Mala, that is Kleda. Okay. Next, we will try to go further. Parinamana Kal, Charachikitsa Sthan, Chaturthe Anni Mausataha. Fourth day, the Mamsa Dhatu will be started to form. Okay. Then Sushrut has said in another fashion, Tadanantar Rasandandram Yeshad Dhatava Te Pratekam Panchabi Ahobhi. So Rasadhatu 5 days, Raktadhatu 5 days, Mamsa Dhatu again 5 days. Total days for Mamsa Dhatu getting understanding, development, minimum 3 weeks will be required. Minimum 3 weeks will be required to see the change in the weight. Half kg weight increase, 1 kg weight increase. How much time you should wait? Up to the minimum. Rasa, Rakta and Mamsa, 5, 5, 5. 15 days you will have to wait. 5, 10 and 15. 15 days you will have to wait for Mamsa Dhatu. Okay. Next. We will try to see next slide. So here you can see there is always a continuous process of regeneration and degeneration. Try to understand. So sometimes it is said it is very difficult when that particular mouse tissue has been formed. But whenever you are treating any cancer patient, say for example HIV patient, muscle wasting patient, anorexia patient, weight loss patient, tuberculosis patient, and you want to see the effect of your Ashwagandha Risht, Ashwagandha Ghanavati, best for Mamsa Dhatu. Bala Ghanavati, best for Mamsa Dhatu. Shatavari Ghanavati with milk, best for Mamsa Dhatu. When you can see at least increase in little weight, minimum 15 days to 3 weeks, there should you have to wait. Because that is a typical Parinamana Kal, time required for getting Mamsa Dhatu. Okay. Guna, properties of Mamsa Dhatu. Na atishita guru snigdam mausam ajaladoshalam Sharir Dhatu samanyat anabhishandi bruhanam. Charak Sutrasthan, chapter number 27. Basic, it is a guru. What is the function of guru guna? You must remember Vyamshanti gunaha. Vyamshanti, 20 attributes. Guru manda himas nigdha. Guru manda himas nigdha. Shlakshna, Sandra, Mrudusthiraha, Gunaha, Sasukshma, Vishadaha, Vimshantihi, Saviparyaha. Don't get afraid. Don't get afraid. I am teaching you. So it is my responsibility to tell you the basic Sanskrit, basic shloka. So in this shloka, Vimshanti Guna, go and search in my books. There is a detail, everything is going detail. So each guna has its own function. Yasya dravyasya bruhane karmani shakti sa guruhu. Which property will be responsible for bruhana, nourishment, is guru. Mamsa Dhatu is responsible for weight gaining. Then what is Shita? Shita is a cold. Stambane Shitaha. So what is Stambane? Which control the degeneration. Which control the degeneration is a Shita, is a Stambana. Don't talk about constipation. No. It is not Malavashtambha. It is a Stambana controlling of degeneration process. It is soft, mrudu, okay? And it is sthira, stability. You can get the stability because of the Mamsa Dhatu, okay? Next slide we will go. Praman, Dosha Dhatu Malanam Parimanam na Vidyate, Sushrut Sutrasthan. He says that each Dhatu is always a regeneration and degeneration process. How we can measure a particular thing? But I am sorry, my dear friends, for practical purpose, Mamsa Praman can be measured 2 ways. Please write down 2 things for Mamsa Praman. Number 1, body weight. by weighing machine. And second, nutrition is examined by measuring tape, circumference of bicep, circumference of the forearm, circumference of the thigh muscle. You make a habit. My dear friends, on my YouTube channel, there is a video of nervous system examination. In nervous system examination, motor system examination is very important for hemiplegia because there is a power loss. And there you have to examine muscle tone, muscle strength, muscle nutrition, reflexes, deep reflexes, all is concerned with the Mamsa Dhatu. Don't forget it. Okay, next. We will try to see the next slide. Okay. Mamsa Karya, Sharira Pushti, Kapha Dhatu, Kapha Dosha function is a nutrition, stability and growth. Nutrition, stability, growth, all is depend on Mamsa Dhatu. And secondary role is a Lepana, giving the shape of the body, covering the body. Dharana Dhatava, to maintain the human physiology from birth to death. Okay, to maintain the strength of the body, maintain the tone of the body. I think I have explained about this. Mamsa Karya Lepan, that also I have explained you. Then, Sira Snayu Asti Marmani Sandhyachi Shrinam Peshibihi Samrutani Atra Balavantaha Bhavantyataha. As I am saying you, because of the Mamsa Dhatu, you get the coating and it is like a shock absorber, similar to the fat. Your internal organs are protected. Your stomach is protected. Why? Because there is a coating of Mamsa Dhatu. Your intestines are protected because there is a coating. Because when you travel, when you make a very strong action, there should be protection of the vessels, protection of the nerves, arteries, veins, nerves, marma, vital points. They should be protected, and they are protected only because of the Mamsa Dhatu. And most important is Akunchana Prasarana Kriya. Don't forget this. Muscle contraction and relaxation are very, very important to make the human being active. Otherwise, it's like a death, dying. As you know, in hemiplegia, like a paralysis. In paralysis, we lose the contraction, relaxation process. There are very serious. Of course, it is not only muscle. It is not only muscle I am talking about. Neuromuscular junction. Please write down. Who is giving the signal? Okay, muscles is a material. Muscle is a material for the movement. But basic energy, Vata Dosha, is coming from brain. Signal is coming. Signal is coming by the corticospinal tract. Will you please write down? Corticospinal tract. This is motor pathway. Corticospinal tract, motor pathway. Signal is, it is called as a descending pathway. Descending from brain to the periphery. Nerve is giving signal. Move, move, M-O-V-E, move. Neuromuscular junction. Synapse, Shabda is very important for Mamsa Dhatu. Synapse. And there are neurotransmitter. For example, acetylcholine, ACH, for this Akunchana Prasarana Kriya. Mamsa Dhatu, Akunchana Prasarana Kriya, ACH, acetylcholine. If neurotransmitter is in problem, what is the disease? Yes, myasthenia gravis. Myasthenia gravis. How that word is come? Will you please write down? Myasthenia. Very interesting. Mamsa Dhatu. Mamsa Dhatu. Sthenia, strength. Myasthenia. Now, myasthenia. Muscle strength is lost. Myasthenia, muscle strength, gravis, very much lost, very much lost. So the disease name is myasthenia gravis because of the deficiency of ACH. Must remember regarding the Mamsa Dhatu. Okay. We will go further. Yes. So all the internal and external movements are depend on Mamsa Dhatu's akunchana and prasaran. So you can see abduction, adduction, all pronation, supination, you flexion, relaxation, everything is depend on Mamsa Dhatu. Then Mamsa Dhatu is responsible for your strength. If you want to fight, Mamsa Dhatu should be very strong. Panja kheltat, you know the playing of panja. You are testing with the strength of the Mamsa Dhatu. So mouse and med both are parthiva. Mouse and moth both are parthiva. What is the difference? Mamsa Dhatu parthiva is a compact. So better strength. Med Dhatu loose. Adipose tissue loose. No compact. Both are parthiv, but Med Dhatu is for only storage of energy. Med Dhatu is a static energy. Mamsa Dhatu is a dynamic energy. Will you please write down? It is not given in anywhere. No teacher is explaining in this way. What is the difference in Mamsa Med? Both are parthiva. Are you understanding? Med Dhatu is a static energy. Carbohydrates are stored, parthiva. But Mamsa, active, dynamic energy. Both are having parthiva, both are having energy, but this is the difference on energy. Okay? So you must understand MD level. Dharana Dhatava. There is nothing to be said about that. It is protecting body. Even Ayurveda has recommended in tuberculosis like diseases, in severe weight loss, Ayurveda has also recommend Mamsa Dhatu for the medicine purpose. Diet, non-veg can be taken in this situation. Even there is a Yapana Basti or different bastis are there where Mamsa Rasa has been used for the treatment of weight loss. Okay, next. Karya, you give the support to the body that I have explained. It is also give the beauty to a person, handsome person because of the muscular growth. Mamsa Sarata, this is the qualitative examination. Qualitative and quantitative examination. Charaka Vimastan. Sarata is the best concept of Ayurveda. As I have told you that you become ill. Disease attacks on you. Vata Pitta Kapha attacks on you when you have the weak immunity. In this corona pandemic, immunity is very popular, immunity. This is the concept of Ayurveda. Sarata is immunity. Sarata is immunity of dhatu. Sarata is immunity of body tissues. Ayurveda says, Rasa, Rakta, Maus, Med, Asti, Majja, Shukra. For each dhatu, every person should be aware of what is my Sarata of Rasa Dhatu, what is the Sarata of my Rakta Dhatu, what is the Sarata of my Maus Dhatu. Everybody should find out. Get it examined from Ayurvedic Vaidya. Prakriti Parikshan and Dhatu Sarata Parikshan is very important for immunity. Prakriti Parikshan and Dhatu Sarata examination are very important for Prakriti. Don't forget. Shankalala Tikrikatika Akshiganda Anugriva Skanda Udara Kakshavaksha Pani Pad Sandayaha Guru Sthira Maus Upachitaha Upachita well nourished Guru proper weight height weight chart Sthira stability no cramp no tremors that is Mamsa Dhatu is strong and because when you person is physically strong Ayurveda says body mind machine body and mind are the two sides of the one coin. Two sides of the one coin. Body, mind, body, mind, body, mind. So when person is healthy with physically, he is fit mentally. That's why here you can see the words Kshama. Can you see the words? Kshama, forgiveness. He will be very dynamic person. He will not bother about simple insults. Okay, forget. Because I am very strong. Dhruti, he has a courage. And alaulya, non-greediness, Mamsa Dhatu, physical fitness will give the mental fitness. Okay. Next slide. that I have explained, everything I have explained. When I explain, I will not go wait for those slide. Okay, everything. Then these are also regarding the Sarata. Okay, muscle power, muscle nutrition. Can you see the pictures? Okay, examination of Mansa Dhatu. Very interesting pictures. When you have expected to see the video again and again, take the pause, take the snapshot, make the notes. This is the from your side, because I have to complete the lecture in 1 hour, because our tolerance level is 1 hour. Okay, this is all about Mansa Dhatu. Then I have explained here, just I will go back if possible. If your Mansa Dhatu is a weak, then you can take Shatavari Kalpa with milk. 1 spoon of, like a Bournvita, Horlicks, you put Protein X granules. No, Ayurveda says Shatavari Kalpa. Sugar granules, drink that particular milk has a very good proteins, no iron, proteins. Ashwagandha, like ginseng, Chavanaprash, okay? Then buffalo milk. And most important, I would like to tell you, most important factor in your practice, please write down for your medical practice. Whenever you see the muscle atrophy is there, weight loss is there, anorexia is there, and you want to improve the Mamsa Dhatvagni, then you must use the black pepper, which is a content of Laghu Malini Vasant. Laghu Malini Vasant. These medicine you should not forget. For cancer patient, for HIV patient, for tuberculosis patient, please give him Laghu Malini Vasant, 2 tablets morning and evening of Baidyanath company, and then use the Shatavari Kalpa. Only Shatavari Kalpa is not helpful, because you have to stimulate the metabolism with Laghu Malini Vasant. And after 2 months, you can give Madhu Malini Vasant. Please write down, because it contains egg, E-double-G, egg, Madhu Malini Vasant. And then after 6 months, if required, Suvarna Malini Vasant. 3 tablets you should not forget in your practice for cancer, HIV, tuberculosis, any chronic weight loss disease, any chronic degenerate myasthenia gravis, motor neuron disease, where the muscles are in problem. You want to stimulate metabolic process. Laghu Malini Vasanta 2 months, Madhu Malini Vasanta 2 months, Suvarna Malini Vasanta 2 months. Suvarna Malini Vasanta is costly. Only 1 tablet every day morning, Rasayana Kal, on an empty stomach with breakfast. Okay. Next slide. Then Narayanatai for muscular tone of the muscle. Strength of the muscle will be improved by full body massage, gentle massage with nutritious oil. Write down nutritious oil. Narayana tail is from Shatavari. Another important oil, Dhanvantaram Kujambu. Dhanvantaram Kujambu is from Bala. Dhanvantaram Kujambu. Ayurved Vaidyashala Kottakal. Arya Vaidyashala AVS. Arya Vaidyashala Kottakal. Dhanvantaram Kujambu. What is meant by Kujambu? When there is oil as well as ghee. Oil and ghee together, Dhanvantaram Kujambu. Don't forget this, very, very important. You have to give this, all muscular problems, weakness problem, tiredness problem, leg pain, you have to give Shali Shashtika Pinda Sweda. Shali Shashtika Pinda Sweda for all marasmus children. I have told Snehana and Svedana for Mansa Dhatu and Vata Dosha. These practical things are very important. I am always, Deshpande is always favor for practical things. Teach the student practical things. Vasa and Shatvacha, this is Upadhatu. We will discuss at some another time. Okay. Khamal, specific, that whenever there is a muscular, what you can say, the degeneration, then you get increase in the here, this mala, waste products from the eyes, wax in the ear. This will have the problem with the Mansa Dhatu. Okay. This will also, we will discuss some another time. Okay. Mamsa Vruddhi, pathological. All physiology we have completed. Now, pathological, two important points, Vruddhi and Kshaya. So, there will be hypertrophy of the muscle, remember, and heaviness of the body. Hypertrophy of the muscle and heaviness of the body, these are the two things. Mamsa Vruddhi, okay? Then, how you have to treat? This is, you can see hypertrophy of the muscle, okay? Mamsa Vruddhi. Can you see hypertrophy and cell hyperplasia? Very interesting. Then here you have to do the Lakhana treatment. Scrapping, because it is excess. Scrapping material, simple thing is Triphala Guggulu. For hypertrophy of muscle, Triphala Guggulu. It is also used for obesity. Kanchanara Guggulu. Guggulu is a ruksha. Lakhana, scrapping. Then Varunadi Kshaya tablet. Patola Nimbadi Guggulu. Patola Nimbadi Kshaya. All these medicines you can use to improve the muscle tone. Kutsala. This herb is very important. Visha Tindukavati. When muscle tone is good, not good, sphincters. Specifically, you remember bed waiting. The children is making the urine in the bed at night after the 6 years, after the 5 years, till at the age of 10 years. That is called as a bed waiting. Nocturnal aneurysm. Sphincter control is not there. To improve the neuromuscular conduction, proper improvement strength, you can use the Vishatindakavati. Then Mamsa Pachakavati tablet is also available whenever Mamsa Dhatva Gnimande is there. Mamsa Pachakvati, like Rasa Pachakvati, Rakta Pachakvati, etc. Okay. Next slide. Mamsa Kshaya. This is more common than Mamsa Vruddhi. Please write down. Mamsa Kshaya in the practice is very, very, very common. Weight loss. Remember, weight loss, loss of muscle strength, loss of muscle power. You know how to check the muscle power? These are my finger muscles, hand muscles. And when I check the hemiplegia patient, no movement, 0 grade. No movement, 0 strength, 0 power. Flickering movement, flickering. Can you see? 1 grade. Can move hand horizontally. Only horizontal, not lifting up. Flickering 1. Movement 2. Lifting little bit hand 3. Lifting up against the gravity. Making pressure on the hand. That is 4th. And our normal fighting strength is a 5. So there are grades how to check the muscle strength. 0, 1, 2, 3, 4, 5. 0, 1, 2, 3, 5. This is important for practice. I have the video of nervous system examination. Please check it out. Okay. Then there will be shushkata, dryness. Buttocks, there will be no buttocks. Cheeks inside. Then weakness, very much tiredness. Your eyes are tired. Your brain is tired. Hands are tired. Legs are tired. You cannot tolerate any physical exertion. Okay. So this is always appearing in the tuberculosis uncontrolled, diabetes mellitus uncontrolled, cancer, late stages, indriya glani, motor organs. You know the Jnanendriya and Karmendriya, Shrotra, Tvak, Chakshu, Rasana, Grana. Very interesting, very interesting. Let me tell you. Myasthenia gravis. What is the first indication, first symptom? I will show you. Look. Can you see? This left eye, drooping of the eyelid. Drooping of the eyelid. This is called as a ptosis. Please write down. Ptosis. This, can you see here? This ptosis is the first symptom or sign in myasthenia gravis. Ptosis, ptosis, because of the weakness of the eyelid muscle. Weakness of the eyelid muscle. Amitabh Bachchan, myasthenia gravis, suffered in approximately 90s. So this is myasthenia gravis. I have explained a lot about myasthenia gravis. So dryness, vak, pani, pad, payu, past. These are the karmendriya. So Ayurveda says jnanendriya and karmendriya. Strength is depend on Mansa Dhatu. Then bony joints, ligaments are there, tendons are there. If they are weak, you will be joint pain also will be there, and overall body will be weak, weak, weak. Can you see? This is very common. Tuberculosis patient. Can you see? No pectoralis, no bicep, no tricep, totally dried. Can you see here the belly of the muscle? No belly, no belly of the muscle. So this is very common in our practice. Weight loss, malnutrition, tuberculosis, malignancy, and HIV or the AIDS. To improve, what you can do, I have already told you. Improve the Mansa Dhatu Agni, Lagu Malini Vasanta. Read on the screen. Lagu Malini, Madhu Malini, and Swarna Malini Vasanta. These are called as the Vasanta Kalpas in Ayurveda. These are very, very 2 month Lagu Malini, 2 BD, 2 morning, 2 in the evening. 2 month Madhu Malini, 2 morning, 2 evening. But Swarna Malini contains gold, Swarna Bhasma. Very interesting. One thing I will explain you. Very interesting, huh? Very interesting last point. Suvarna Siddha Jala. My dear all viewers, will you please write down those who cannot afford gold compound of Ayurveda, Suvarna Bhasma of Ayurveda, Hiraka Bhasma of Ayurveda. I am telling you very, very simple home remedy. What is the name? Suvarna Siddha Jala. Gold processed medicated water. Gold processed medical water. Simple. Take 1 glass of water. Clean your gold ring, which is not regularly you are using, kept in as a you are saving. Take it out. And that Suvarna, Sonyache Vada in Marathi. That ring of gold, you have to hit on the fire till it becomes red hot. Till it becomes red hot. Dip in the glass of water. There will be typical sound. Again take it out. Again hit on the flame of the fire. Flame on the fire, gas. Put it in the water. This process you have to repeat for 7 times. Hitting the gold, dipping in the water. Hitting the gold, dipping in the water. Hitting the gold, dipping in the water. Then cool down that water and drink it every day morning. 1 glass of Suvarna Siddha Jala. This is the best to improve your muscle tone, muscle mass, and muscle strength. Mansa Dhatu Upachaya. Mansa Dhatu Samhanana. Mansa Dhatu Karya. Suvarna Siddha Jala. I hope very, very new and interesting things you have learned today when you are learning simple physiology of Ayurveda. Mansa Dhatu. So this is very interesting. Whatever I have told you in this video, Mamsa Kshaya. There are different medicines. You have to, sometimes you have to prescribe that Rajma, soya bean is very good for Mansa Dhatu. Nathani is very good for bones as well as for muscle. Milk is very good. So Bala is one of the best medicine. Bala Arishta is available. Bala Dhanavati is available. Narayan means Shatavari. Maha Masha Tel. Mash is a black gram. Udid is very good Mansa Dhatu. Internally, Balarishta, Ashwagandharishta, and Shatavari Ghrita. These are very important medicines. This is, you can see the Mansa Kshaya, 2 sides of the legs. Balarishta. Can you see the plants? Very beautiful plants. Bala and Ashwagandha. Oil massage, must. Shali Shashtika Pinda Swed. Very, very useful treatments in your practice. Don't forget this. This lecture is very useful for you all the time. Treatment of Mansa Kshaya. Chicken, eggs, tofu, nuts, high protein, legumes. All legumes. Legumes are important. Now I will tell you. Tur dal and munga dal. Green gram. Both pulses are having the proteins. But Ayurveda says the person having acidity, he should not take tur dal. Hyperacidity, weight loss, munga dal. Green gram is better than tur dal. Okay, these important things that I want to tell you. Next, Mansa Dhatu problems due to the vitiated Vata dosha, Ruksha Guna. If they increase in the, this is very important slide, very important. Write down slide number 75. When you look the video, stop over here. When Ruksha Guna is increases, muscular pain will be there, sprain will be there, fibromyalgia, ankle sprain will be there. So you have to treat snigdha, oil massage, Shalishritic Pinda sway. Now, Lagu Guna increase in Mamsa Dhatu. Vata dosh has attacked. This is very, very special. Dosha, Dusha, Samurchana I am explaining, and Anshansha Kalpana. Anshansha Kalpana, subtle treatment. Subtle. You never have heard about this concept because that decides pinpointed treatment, sharp treatment. Ruksha Guna, use Snigdha Guna. Lagu Guna, use the Ushna Guna. Sorry, Guru Guna. Okay? So Lagu Guna causes muscle atrophy, marasmus, and cachexia. So here you have to use the nourishious diet. Guru Guna. Shita Guna causes. When Vata dosh attack on the Mamsa Dhatu, but Shita Guna, then shivering, then mustard oil, application of mustard oil, Ushna Guna, fermentation, Nadi Sveda, Sona, steam bath, then stiffness of the muscle. I cannot move my neck. Oh my God. Oh, doctor, I cannot move my head. It's locked, stiff. Back is stiff. Then you have to mobile it with giving some fermentation because Shita Gun can cause Stambane Shitaha, excessive obstruction, Stambane Shitaha. Stiffness, you have to use the hot back fermentation, infrared lamp, Nadi Sveda, Parisheka, Avagah Sveda, tub bath. Kharaguna increases, then muscle contractions. Contracture, not contraction. Contractures will be there. Khara, excessive dryness. So excessive again and again massage, again and again Shalishritic Pinda sway for 6 months, 1 year. Then by chance, contracture will relieve, otherwise not. This slide is very important for post-graduation. Sukshma Guna increases, Vata dosh attack. Sukshma Guna, embryological development problem in Mamsa Dhatu, genetic diseases, like for example, muscular dystrophies, congenital myopathies are there. Then Chalaguna of Vata dosha has increased in Mamsa Dhatu. All is Mamsa Gata Vata. Will you please write down this word? Please. Mamsa Gata Vata dosh. Mamsa Gata Vata. But we have to check which of the property of Vata dosh has attacked which property. Then according to property, you have to select the treatment. Chalaguna increase, tremors will be there. Tremor, senile tremor, Parkinson's tremor. Okay. Sneha and Ushna Guna increases, abscess formation. Now we are talking about Pitta dosh is attacking on Mamsa Dhatu. Pitta dosh is attacking on Mamsa Dhatu. Dosha, Dushya, Samurchana. So when Pitta with Sneha and Ushna attacks, abscess will be there. Tikshna Gun causes inflammation, myositis. Lagu Guna causes disuse, atrophy in the muscle. Visra Guna causes putrefaction in the muscle, gangrene, koth in Ayurveda. Sara and Drava Guna causes muscle flaccidity and defective protein metabolism. Very interesting slides, this 67. Now, Dosha, Dishya Samurchana with Kapha dosha. Kapha is attacking on Mamsa Dhatu. Attacking with Snigdha Guna, so there will be myomas, tumors. Leiomyomas or fibroid growth from the smooth muscle. When Shita Guna attacking on Mamsa Dhatu, muscle stiffness, muscle cramp. Manda Guna attacking on Mamsa Dhatu, soft tissue sarcomas, fibromatose, and hemangiomas. Then Sthira Guna causes attack on the Mamsa Dhatu, muscle rigidity and muscle spasticity. This is very subtle approach. So, my dear friends, this is all for today. Professor Dr. Rajendra Deshpande, that is myself, has today given you very interesting video regarding Mamsa Dhatu of Ayurveda. physiology, pathology, treatment, everything. So this is not only Sharir Kriya, this is a Sharir physiology, pathology and treatment. Dr. Deshpande always give all the knowledge, compiling holistic approach. That's why you like my videos, and I request all of you by folding my hand to share these videos with your WhatsApp groups and also your mails, etc. And ask all your friends, doctor friends, students, colleges, teachers, make a fire, health ambassador. And Dr. Deshpande is doing very, very hard work, genuine work. Please subscribe his YouTube channel. Thank you very much. I say you bye-bye. I am closing my sharing and sharing you the bye-bye, telling you the bye-bye, okay? Bye-bye, my dear friends. All the time best to you. Happy, healthy, and long life.